One of the most common things encountered in my clinics for both hip and knee problems relates to structures that are interconnected to one another. Very often there's a group of muscles called the hip abductors that start on the back of the pelvis, located at the sacroiliac joint, can wrap all the way around the outside of the hip past the greater trochanter, and down the outside of the thigh into the knee, becoming the IT banded insertion into here. When anything within this muscle group or band of tendinous tissue becomes inflamed, it can become extremely painful. These muscles are responsible for supporting the pelvis, secondary stabilizers for the hip, and secondary stabilizers for the knee. Sometimes they can even snap and catch over the hip or the knee. So one of the things that we want to do for this is to try and maximize the function of these muscles. And when they become tight and tense, it can become extremely painful. So this group of stretches is designed towards optimizing this overall muscle group. So one of the first things that we do is if my right side is the affected side where my hand is at, one thing you can do is gently push on the knee to the outside and feel a stretch. Now, if you feel pain going up the outside anywhere along the entirety of this sequence or stretch of musculotendinous tissue, then you need to push less far till you just feel a stretch. Now, if you're able to push all the way to the outside and experience no pain or stretch, then the next step would be to take and cross your right foot over the left and then to gently push. And the idea behind this is till you get a stretch. Once you feel a stretch, you hold it for 10 seconds and relax. And you do a set of 10 of these 3 times a day. Now, if you felt the stretch here, the next step would be is working on crossing your legs over like that. Then what you will do as time goes on is with your right leg over the left being the right side we're stretching, you would take your left leg and stretch it out just a little bit further every week. So after you've done this a set of 10 3 times a day for a week, you keep working until your leg is all the way straight. Always only to stretch, never to pain. Then every week after that, you would work your right leg up as such until you were all the way up to here. Now the next step would be is bringing the left leg in. And as you do this, this will maximize the stretch to the entirety of that band and structure of tissues. You'll want to do a set of 10 3 times a day, holding for 10 seconds, with each week having a progression thereafter. After you've completed that, the next step will be is to work on strengthening. And one of the ways that you can do that is with your feet pointed forward, you will take your leg and you will gently take it to the outside. And what this will do is strengthen these muscles. You don't want to begin the strengthening until you've progressed forward with the stretching for at least 4 to 6 weeks. And you can change the difficulty of this based off how long you hold your leg to the outside. So the longer you hold it, the greater the strengthening it is. Also, the more you lean towards the side that you're trying to strengthen, the more you strengthen that side as well. All right, hopefully, as time goes on, this will continue to improve your pain located in this entirely large area of musculotendinous structures.